For this segment, I'm excited to be joined by the Insurance Department's Tori Fowler, Administrator for Life and Health Compliance. Welcome back to the show.
Thanks, AJ. Happy to be here.
So we're getting to the end of the calendar year, and that means everyone should be considering their employer and marketplace health insurance coverage for the next calendar year. Before we talk about plans, can you remind the audience of what the Federal Healthcare Marketplace is and where people can check out what plans are available there?
The Federal Healthcare Marketplace, which is also known as the Exchange, came about as a result of a comprehensive healthcare reform law enacted in March of 2010. And the goals of this law were to, 1, make affordable health insurance available to more people, 2, expand the Medicaid program, and 3, support innovative medical care delivery methods designed to lower the costs of health care generally. Now, people can go and check out the Exchange by visiting Healthcare.gov.
And what's the advantage of purchasing health insurance through this exchange?
The exchange is pretty neat in that it offers a convenient platform where shoppers can compare and access different plans. They can find the best plan for them by filtering results by, say, their budget, network provider, location, covered medical services, or insurer, all in one spot. In addition, a big advantage of purchasing health insurance coverage through the exchange is that individuals and small businesses may qualify for financial subsidies on the exchange. These forms of assistance include premium tax credits and cost-sharing reduction subsidies for people with lower annual incomes in order to reduce the cost of their monthly premiums.
So the plans on there are referred to as qualified health plans. How does the New Hampshire Insurance Department regulate them?
A qualified health plan, which we call a QHP, is an insurance plan that's certified by the marketplace and provides essential health benefits, follows established limits on cost sharing like deductibles, co-payments, and out-of-pocket maximum amounts, and meets other requirements under the Affordable Care Act. Our team, our forms team, reviews each of these policy forms to make sure that the forms are compliant with state and federal laws and regulations. We dedicate an entire season to reviewing these forms so that consumers will be ready to go once open enrollment starts on November 1st of this year, going through January 15th of 2024. So that's the window of time consumers have to purchase a plan through the exchange. Now, there also is what's called a special enrollment period for people who experience life changes. So, if you do experience like getting married, having a baby, getting divorced, there's a whole plethora of different situations that can arise in order to qualify you to access health insurance coverage through the exchange outside of the open enrollment window.
Are there timeframes where for these qualifying life events they should jump on getting coverage, or is there an expiration date for that?
Yes, you really should contact either Healthcare.gov or a local agent in order to get the details as to whether you need to obtain that coverage within 30 days or 60 days. But yes, time is of the essence, so it's important to take action as soon as one of those qualifying events occurs.
Can you describe a health savings account and why they might be important to New Hampshire insurance consumers?
Health savings account is a tax-exempt savings account that's available to people who have high deductible health insurance plans. The money in their account can only be used to pay for qualified medical expenses. Now, contributions to an HSA, health savings account, are made with pre-tax dollars. This means that a person does not have to pay any income tax on those monies, which results in substantial tax advantages. Unspent money in the health savings account rolls over at the end of the year and can be used for the next year's health expenses. This is different from another process called a flexible spending account, where the money expires at the end of each year. Health savings accounts is a great choice for certain people who will benefit from using high deductible health plans.
Super important to reinforce this. When is open enrollment and what should people do during this time?
Okay, so open enrollment starts on November 1st of this year, which is only about 11 days away. And people can visit the website Healthcare.gov. And if they do that and they're looking for information as far as where to go for help, they can actually click at the bottom. There's an option that says Find Local Help. And if you click on that tab, it'll bring up a new screen where you can enter your city and state or zip code, and that will actually bring up local agents in your area who can help walk you through obtaining health insurance on the exchange.
And these are the people also that can assist you with obtaining subsidies to help pay for these plans also.
Absolutely. Healthcare.gov also has an 800 number, which is 1-800-318-2596. So if you're experiencing any issues with finding a local agent, you can go straight to healthcare.gov and they can help you with that.
And if you have any questions, any issues with this process at all, please do reach out to the New Hampshire Insurance Department's Consumer Services Division. They help people out with this all the time. Please call them at 800-852-3416 or consumerservices@ins.nh.gov. Thank you so much for Tori Fowler, Administrator for Life and Health Compliance, for joining the show.